Let's dig a little deeper into this story and bring in a medical expert to help us out. Dr. Robert Tiballi, infectious disease specialist from the Catholic Medical Association, joins us now. And Dr. Tiballi, while of course it's concerning to hear about these blood clots, it's 6 cases out of some 7 million doses distributed. So put this into context for us. And in your opinion, what should people do if they just got the Johnson & Johnson shot?
Well, these clots that we know of are exclusively in women. Now we don't know if that's going to bear out over the long term. If there probably will be other people who are diagnosed with this condition, it's still going to be a low incidence, I believe. Very similar to the AstraZeneca issues. These are kind of similar technology vaccines, and the technology is not the same as the Pfizer or Moderna vaccine. But I would tell you not to worry. The patients develop these conditions between 1 and 3 weeks after being vaccinated. And it's basically a very, very severe headache, worst headache that you've ever had type of thing. It's easily diagnosed with an MRI.
Now, we've previously talked about COVID possibly causing blood clots in people's lungs. Now it's a vaccine that's causing it. Is it possible those 6 cases may be people who had COVID in the past?
It's really unclear, and it's hard to say for sure at this point. Um, Clearly, people with low symptom COVID could not know that they ever had COVID, and if they got a vaccine, they could have an augmented immunity response. There's actually a paper in preprint form from Europe regarding the AstraZeneca clotting issue, and they propose a mechanism by which an immunological response is made to the vaccine, and it kind of cross-reacts with this platelet factor number 4, which then can potentiate platelets becoming activated and clumping together. But it's not really clear whether it's an augmented immunity response to having COVID in the past, or whether this is just something that someone can get from having the vaccine. But it is interesting that the AstraZeneca and the Johnson & Johnson are both what we call vector vaccines. They're associated with a virus, and it could be a response to the virus as opposed to the spike protein from the coronavirus section of the vaccine.
All right, now I want to move on to a different vaccine. There have been reports that the South African variant can break through the Pfizer vaccine. What exactly does that mean, and should we be concerned?
Well, the longer that we experience coronavirus and the more people that have it, the more variants we're going to have to deal with. So the vaccine still provides some protection, and it's better to have your immune system recognize maybe a cousin, if I can call it that, to the South African, to the wild strain, than never having seen a coronavirus before. But next year, when we'll probably get a vaccine that'll have multiple subtypes in it, not just one, and it will have representation for the South African, the Brazilian, the California variant, and other variants as they emerge.
So you do think we're going to be taking these vaccines every year?
Unfortunately, this will become an influenza-like annual vaccination for most of us for many years.
All right, Dr. Robert Tiballi from the Catholic Medical Association, thanks so much for being with us and clearing those things up for us.
Thank you very much for having me.
If you're watching Currents News on YouTube, be sure to hit the subscribe button and click on the bell to get updates to all of our newest content, because we are putting your faith in the news.